Boom. And we are live with another episode of the Brown Water Banter podcast. My name is Jared Seymour.
My name is Joey Cates.
That's right. We got a great show lined up for you this evening, man. We have Dr. McKay in the studio. He's going to be talking to us about men's health, overall men's health, and the things that they do over at Trillium Medical Aesthetics and Gynecology. That's going to be something to get into here. Guys probably like, what are we talking about? Gynecology today? No, it's men's health, and we're going to get into it. But before we do that, we're going to thank the people that keep the lights on for us over here at the Brown Water Studios. Right out of the gate, I've been beating this drum all year. Here we are in August, and 2023.
August, yeah.
It's the year to keep your mouth clean. We want to thank Dr. Robbie Williams over at Southern Magnolia Smiles, man, for supporting the show. They are at Southern Magnolia Smiles on Facebook and Instagram. He's located in Washington Avenue, in Ocean Springs on Washington Avenue. And if you want to book that appointment with him, you can give him a call at 228-215-1202 and tell him that the Brown Water Banter podcast sent you. Rolling right along, we have our friends over at Taylor & Cox Law Firm. They've been practicing law in Pascagoula for over 30 years, representing people of the Mississippi Gulf Coast. If you find yourself in need for legal representation, you can give them a call at 228-696-0111. They specialize in criminal law, family law, and civil litigation defense. We also want to thank Taylor & Cox for sponsoring the Brown Water Banter app. If you don't have that now, you can go download it for free on the App Store and Google Play, but they're taking us all the way to the end of the year on that, and we really do appreciate it. Our buddy Rocky Brooks over at Sea to Swamp, they are your outdoor tackle, apparel, local one-stop shop. If you want to check them out on Facebook, you can look them up, Sea, the number 2, and Swamp. Rocky's got 2 locations in Gaucher and Gulfport, so you can give them a call at 228-205-3964. He's selling everything, man. Rods, reels, tackle, apparel, kayaks. He just got a big shipment in of some new reels, I think. What are those?
The Stratics.
No, it's like a new
brand. Yeah, those bass, those low profile reels.
Yeah,
they look like they're all aluminum. I didn't look at them.
They look legit. So so give them go check them out, like I say, over in Gulfport or Gaucher, Sea to Swamp. And then we have Forever Young Men and Women's Health. That's our buddy Kendrick. If you're feeling lethargic, feeling like you can't get off the couch, you need a little boost of energy, or possibly you need some lab works done to check out. Maybe you need hormone replacement, vitamin deficient. Could be a number of things, but put your care in the hands of a professional. You can give them a call at 228-363-6623 and get moving again. So we've got Randy Bosarge, our District 5 supervisor, who was recently reelected. He came on, did the show, did an episode, talked to us about the economic future of Jackson County, and decided that he wanted to continue on the sponsorship for the rest of the year. So we want to thank you, Randy, for doing that. And we're going to reach back out to Randy and get some, we need some pointers as to like what he's got going on, some future upcoming stuff for the county that we can talk about, and probably get him back on the show too as well. So we want to thank all of our sponsors for supporting the show. But Dr. McKay, man, let's get into it. So we always like to introduce our audience to the person here. So give us your background about like how you got into medicine to begin with.
If I remember right, started probably when I was in high school. I had an interest in it, and it just really never wavered. I guess I was fortunate, how trying to figure out what you're going to do in life, and I always knew that's what I wanted to do, and I went on and I did it.
I'm always jealous of people like that. We've had a bunch of people in here that just knew from the get-go. I still don't know what I want to do when I get older, so I'm very, very much jealous to a story like that.
So, I grew up in Louisiana, went to LSU undergraduate, LSU College, went on to LSU Med School in Shreveport, went to Maryland and did my OBGYN residency there, and then I interviewed around and I ended up Gulfport.
There you go. Not a bad place to be.
No, I've been here 30 years. It's hard to believe.
You're one of us now.
So.
Yeah. This home now,
Yeah. So people that may not know, gynecology, OBGYN, that's typically, female related. Actually, never mind. I ain't gonna get into that. But female related. But so you've got the am I saying it right? Trillium.
That's correct.
Aesthetics,
that's correct.
And that's explain the difference between what you typically would do as an OBGYN and then for the aesthetic side, the business side.
Well, aesthetics, it's a big, broad term, and you different people do different things, but you're basically trying to help someone with their looks or their skin care or just something along that lines.
Right.
It's definitely not gynecology.
Right.
Right.
No, it's
Yeah,
not.
yeah, yeah, yeah.
We're not
The
trying
name's a little bit confusing there.
we're not trying to run our audience off either. But so it's kind of goes in line with like the new way of thinking with medicine, not just being defensive medicine, right? Proactive, treating things before they become a problem, or with like hormone replacement, which we talked about a little bit before we went live, fixing something that maybe is on the decline for a man, right?
Yeah, if you talk to any male that has had low testosterone and they got it treated, got their levels where they need to be, it's life changing.
Absolutely.
You're a couch potato, you get treated, you're back to your normal self, feeling good, high energy, great thought processes. It's a big, big difference. I joke and say, it's menopause. You have women that go through menopause, but the guys also do go through menopause, and it's really been overlooked a lot in the past, but now it's really kind of moving to the forefront.
Yeah. And y'all do the whole thing, blood work, all that stuff, put them on a program as well?
We do, and most of the men I either treat with testosterone injections or testosterone pellets. It just depends on what they would rather do.
Okay. And I think one thing that as I was reading like your website and stuff like that, obviously you do a lot for the women's side of things, but you focus on, and I kind of listed it in the show notes here, is like skin health, sexual health for men, which kind of seems, unique to your side. What would a guy come into you and see about like skincare, right? I know a few guys that have done certain things. What would be some of the things that they would come to you for?
Well, initially they'll just come and say, what can I do for my skin? And we usually go through a regimen of how to take care of your skin. And really one of the most important things is sunscreen.
Right.
If you want to do any one thing for your skin care, it's sunscreen. And then if you're going to be out in the sun a lot, just cover up. Now, there's plenty of garments that are comfortable and cool. It used to be, that's going to be too hot. But that you can wear to really protect your skin.
All the brown water shirts, the dry fits are
UPF 50.
Hey,
there you go.
Shameless plug, right?
There you
So
go.
are you getting a lot of men coming in with, I guess, melanoma is what you call it, stages
I had
melanoma?
a precancerous cells cut off on my back this year, so I can relate to what you're saying.
A little bit of that, more so. It's I don't like these lines. I don't like this wrinkly skin. More things like that, and how to treat it. And I think men are slowly moving into the realm of women. We all want to look a little bit better, a little more youthful than we are, and not really old and wrinkled up prune like used to do.
Yeah. Well, it used to be, I guess, kind of taboo for a man to go in and say, I got wrinkles. You know what I'm saying? That used to be like your manhood. Like, I work for these wrinkles. You know? But I guess the pendulum's kind of swinging a little bit.
Yeah, I still like the old school, like Clint Eastwood types. Just kind of gracefully just get old and wrinkled up. But that ain't for everybody, right? So, like you said, the pendulum's swinging. And men are kind of coming out there to say, hey, look, what can we do?
You have I think you have more single men than say you probably had 20 or 30 years ago, and they're out there dating and they want to look better. And it's not just their face. We do liposuction and things like that to trim them down, make them look good,
get rid of that dad bod.
Yeah, exactly.
What specifically are some of the treatments? Like you mentioned, you do like a targeted liposuction. Did I see that on your website?
Yeah, it's a little more like, it's called smart liposuction, which is really done under local anesthesia. So you're awake, you're talking to me. We do it. We have you stand up, look at places, make sure they look good.
Really?
Because it really looks perfect when you're laying down. It looks different when you stand up.
I didn't realize you could do that without being put under.
Yeah, we sure can.
Do a lot of stuff. And being wide awake.
You'd be amazed at what you can do under local anesthesia if you just can get past the first 10 minutes and being anxious about that you might hurt, but you really don't.
Yeah. So you could actually just start sculpting away and stand up and be like, all right, take a little off to the right, doc, and take a little bit off the left.
We're laughing, but it's really somewhat like that.
Right.
Get up, let me look and see.
It's like, can you get these bush lights off of here? What about this chicken wings over here? Yeah.
So, with guys, you don't really think about it, but, the man boobs or some guys have a little gynecomastia. We also deal with that. Mm-hmm. And you can do that under local anesthesia. And it's amazing to me. Yeah. I was a little skeptical in the beginning, but they talked me into doing it and not doing it on myself, but participating, doing it, and I was like, man, we can do it.
Yeah,
I can do this.
Well, the aesthetics part, especially plastic surgery, I know there's two different. Some people use it for healing. Some people use it for joints and stuff like that, and some people just use it for the Kim Kardashian kind of look. You know what I'm saying?
Yeah. So we do a lot of platelet-rich plasma treatments for many different things. It's really interesting in that the science came from veterinary medicine and the horse racing industry. Mm-hmm. They discovered it. They figured out how to use it to heal the horses, get them back on the track faster, and then they just migrated into sports medicine, aesthetic medicine. Mm-hmm. And we treat a lot of joints with joint pain, and really we get the patient usually after they've tried everything else.
Yeah.
And they're just not getting better, and we do it. And what you're really doing, it's very simple. You're taking plasma from the patient, and it has a platelet, and we spin it down and get the platelet-rich part, and that is your healing mechanism. Mm-hmm. So we're taking the healing mechanism, we're focusing in an area and concentrating it in that area. So it's really, I'm skeptical every time I do it, but these patients get so much better.
Really? Mm-hmm. The plasma is, I'm guessing that's the main part in your blood, right? Can you take that from anywhere, or do you have to take it from a certain part of the body, or how's that work?
No, we just get it. We just do an ordinary blood draw.
Yeah.
And everybody's had blood drawn, and they put the tubes over there, and the red cells settle out at the bottom, and the plasma settles out at the top.
Mm-hmm. And you just shoot the good stuff to them.
Mm-hmm.
Yeah, they put it in a centrifuge.
Right. Spin it. Yeah, like oil and water.
Correct. Right. And then inject it. Now, when you say like joints and stuff, what type of, is it injury? Is it inflammation? Would you do this on something like a knee that's been like a total knee replacement? Like, what's the gamut here of what you treat?
Well, probably not a total joint, but the people I've treated prior to getting total joints have gotten a lot better.
Okay.
And a lot of them know, I have a lot of wear and tear on this knee and injury, whatever. And we treat them, and it decreases their pain, and it buys them time. And I would say it probably goes a little further in making the area healthier. When they do have to have a total knee, the bone structures or the tissues are in better shape.
Okay.
Yeah, so that makes sense.
This is pre-major surgery.
Yeah.
This is try it before you get the whole thing redone.
Right. And, like I said, I've done wrists, elbows, ankles, anywhere where I can get to it. I really can't do a hip.
Right.
Because it's just too deep, and you really need x-ray guidance to get there, but just darn near everywhere else.
Yeah.
And, and a lot of like inflammatory processes like tennis elbow or golfer's elbow or something like that.
Yeah. This, you hear a little bit more about stuff like this in the media nowadays. I don't know what the right term would be, like new medicine, really. I mean, it's been around for a while, but like you're saying, like kind of using non-traditional ways of treating things, right?
Mm-hmm.
Right. And
it's a nice alternative.
Right. Yeah. Right. You hear about like stem cell treatments.
Well, just like the ladies we had on last week
for neurocare. Yeah.
Neurocare. Yeah. They did this. I mean, they pretty much said the same spill. They come to us, and it's pretty much everything else has failed. Yeah. So we need something else to get us over that edge.
He's talking about ketamine infusions to treat depression that's been non-responsive to other forms of treatment. So
usually the guys and girls that you get have been in pain and have been in pain for a while. Yeah.
So we also have, other uses for the platelet-rich plasma. Speaking of Kim Kardashian, we do something called a vampire facelift, where we put a little filler in. We take the platelet-rich plasma and put it in other areas to increase volume. Mm-hmm. And so it does all that, and then it makes your skin look fantastic.
Really?
Yeah. And it's amazing, but it recruits stem cells, it increases blood flow, it increases your fat content. So it's fascinating, to see what you could do with
It's
it.
weird. It's weird how the body works. Some places you want fat.
that's
Most places you don't. But like in the face, it can help, right?
Yeah, because as we age, we lose fat, we lose bone mass, we lose muscle mass,
Collagen, that
collagen.
intercellular matrix goes to shit.
Yeah.
Yeah.
Well, it used to be, I guess, back in the day, plastic surgeons only did like boobs and butts. Now it seems like they're doing. I mean, you can do calves. You can do.
Yeah.
I mean, the cheek,
Talking about
face,
implant-wise,
implants.
what you're
Why?
talking
Yeah.
Right.
Plastic surgery in the face, I think, is going a whole new level in the past
Oh,
5 or 6 years.
Yeah, because I was gonna say Dolly Parton and Michael Jackson were getting cut up.
Yeah.
Back in the 80s.
Correct.
They've been doing it for a while.
Yeah.
Yeah.
And one of the other things we use PRP for is the P shot, and it is just what it sounds like,
right, right.
But it's for men with erectile dysfunction. We've had fantastic results with it. The only group that really has not 100% improvement, or if you're a bad diabetic, they have so much vascular disease. Usually, by the time I see them, that we try it and they have some results, but everybody else has fantastic results.
Now, for the erectile dysfunction part of it, is this something that like Viagra is non-responsive to, or are we talking about a different mechanism?
Well, a lot of people get to that point where they're either tired of taking it, or the side effects of it, or they want to have a love life that's a little more spontaneous, where they
Gotcha.
Don't have to plan ahead.
Don't have to plan ahead, take that pill 30 minutes ahead, or take it 4 or 5 hours ahead.
Right.
Or they're like, yeah, that all works, but I'm just not having the same firmness or whatever that I had when I was, younger.
Yeah.
And it increases the blood flow, and so it works.
Yeah.
It's amazing.
The feedback that they're saying is, how long will a treatment like that last for? Is this something you got to get regularly?
Well, somewhere around a year to a year and a half.
Oh, wow. Okay. Yeah, that's pretty significant and how do you give it to them for that? Is it
we inject them
Mm.
in about 5 spots, and everybody's like, oh my God,
Put me to sleep.
Men are not good with needles to start with, but we use a lot of topical numbing medication, and you really don't feel the needle stick. You feel pressure when you're injecting the PRP into the different areas.
Right. And I would assume most men, although we do hate needles and would definitely hate needles in that area, for that particular carrot on a stick, you would do it.
Go for it.
Yeah.
It would be worth it, right?
And really, when we finish, most guys are like, oh God, that's
Yeah.
not nearly as bad as I thought it's going to be.
Right.
So
what are some of the other things we were talking about before we went live that that are more men specific?
Okay.
Yeah.
For younger guys, we have a new machine that's going to be here in the next week or two called AvaClear, and it's going to be 3 laser treatments for acne, and it'll literally get rid of your acne. And it doesn't matter if it's on your face or back or chest, wherever, and it just bypasses all those medications.
Yeah, that's
think about it. If you have acne and it's bad, you get on several antibiotics, then you get on Accutane or other things, and you have to have your liver enzymes monitored, and your skin peels, it gets really dry, and you just battle it, and it'll get better. It waxes and wanes, it gets better, it gets worse, it gets back and forth. But what it does is similar to hair removal. You hit the shaft, the energy goes down, destroys the hair follicle. This really turns down that gland that makes the oil that causes the acne, and it's amazing.
Can you? Does this work on high school? Can you just recommend it on high school kids, junior high kids when it's there?
Yes.
Yeah.
Okay.
Yeah.
So all ages.
Really any age.
Yeah.
Right. They would predominantly be the ones I'm assuming that
and
would be looking
because
for this, right?
that's when it really bothers people the most, and you want to get it early so they don't have the really bad cystic acne and get all the scarring.
Yeah.
Because that's traumatic to them. They're struggling, going through puberty anyway, and
right.
all of a sudden you add that, and it's hard enough with self-image not to add a whole bunch more
especially
things.
in an Instagram, Facebook world that we live
Yeah,
in now.
instantaneous.
Everybody see the face.
Social media.
Mhm.
What's the process of that? They come see you, or they come from a dermatologist, or how does that work?
Well, I don't think that any of the other dermatologists have it, but yeah, if you want to come, just find us on Facebook.
No
or-
referral needed, I think.
No referral
That's
needed.
what he's asking.
Yeah.
And what we do is a little bit different. We do a free consultation.
Mhm.
Tell you what, because a lot of people come in with different ideas, and I'm like, no, I can't do that.
Right.
Here's what I can do. Here's what I can't do.
Right.
So, free consultation, and then you decide whether to do it or not, and we set it up.
That's cool.
What we touched on this, and you let me know right out of the gate. There's zero hope for me. But hair restoration.
Yeah,
Yeah.
Look, Jared was right
He
here.
took one look and said, "You are way beyond. You're terminal.
Yeah.
with your hair condition."
So we've had really good results with hair restoration, both men and women, and I'm amazed at how many women come in. But
I would think this topic of all the ones for the men would be the one that they would perk up for the most, right? Like Botox injections for the face. I know some guys do it, but when you talk about a man's hair, he's like, oh, look, what can you do?
That's your
they don't care about.
masculinity.
Yeah, exactly. Unless you look good bald headed, like
there's a couple of things. If an area has no hair for more than 2 years, it's probably gone. Anytime before that, come in, and what we see so many follicles, and you see some immature follicles, and when we treat you, and we've got a new product that we've added called Derive, and it causes the hair itself to get stronger and thicker. It makes those immature follicles start growing hair, and then you recruit a few more that have been dormant. And so just those little changes in a square centimeter translates into a big difference.
Yeah.
The most difficult thing about hair restoration is it takes a year. And that's that for everybody to wait that long in today's age of instant gratification is kind of difficult. I have to say, hang on, because the treatments are about 2 months apart.
Okay, that's what I was going to ask.
You apply the Derive every day, and but it's been amazing. There's really, like I said, we've had great results with people thickening their hair and increasing their hair follicles that are growing.
Okay.
So it's great.
You may have said it. I was checking the thing here, but the actual treatment, how is that?
Oh, the treatment is a PRP treatment.
Okay.
So we draw your blood and do all that, and we inject the PRP deeper into the scalp, and believe it or not, it's really not very painful.
Okay.
And then my laser tech takes something called microneedling, which is a row of needles, and it goes down just superficially, and it injures the skin. And then we go back and take the leftover PRP and place on top of that. So you have PRP below the skin and in the skin. And it starts increasing the blood flow, waking those cells up right away. And now we've added the Derive, which you do every day at home.
That's like a
cream or
it's just this really light liquid, and it's the technology there is it's a cell communicator. So you don't think about the cells communicating, but they do, and it turns those cells on and makes them communicate to the hair cells, start growing.
That's pretty cool.
Yeah. Maybe for you, I don't
know. It's been more than 2 years. It's been more than 2 years.
The other thing is, it's neat. When I went for the training, the guy that was training us, they use it on spots where somebody has a beard that might be thin compared to everywhere else, or a blank spot in a beard.
Like a bald spot.
Yeah.
I can see where you get a lot of women, because women, I know my wife says it all the time. My hair's falling out. My hair's falling out. So do you see more men than women, or women? Is it pretty much?
It's really about half and half.
Yeah.
And of all ages, I had a guy yesterday, young guy in the military, and he's like, I do this treatment once a year because my hair without it starts getting really thin. And so he says, I'm looking at my dad. I'm saying, I'm going to get this treatment once a year, and I'm going to do it. I'm single. I don't want to be bald. I'm in the military, know. So
what's that? Did you say what that usually lasts? The treatment?
but, at least a year.
So it'll be good for a year.
Mm-hmm.
Yeah, two treatments. You said in a year.
Well, like he does once a year, kind of
Okay.
as maintenance. But if you're really going to undergo treatment, it's 3 treatments.
Okay.
About 2 months apart.
Yeah. I would just love to be able to walk around and tell people like, my gynecologist is telling me that my hair is getting better, and just watch their face at the party, be like,
Yeah, what?
Yeah, that's worth the treatment right there. So where are you located? And how does, in other words, somebody hears all this, they want to come check you out. What's the first step in the process?
Well, you can look us up on Facebook or Instagram.
And I'm gonna drop that in the comments right now too. So
you can Google Michael McKay, MD. That's me. Our office is at 2045 East Pass Road in Gulfport, and if you've been through that area, you'll know it. Everything in there is brand new and white. Because Ivan Spinner and some guys have gone in there, and it was a rundown area. They got the land and buildings at a good price, and they've just rehabbed it, and it's taken off.
Yeah.
If you need a phone number, it's 228-760-2995. But you'll see our sign. We're in the same building with Jernigan Chiropractic. A lot of people know that.
Yeah, Jernigan, he's a good dude.
Yeah.
Yeah. So, you brought up something earlier about sleep.
Yeah.
Some new stuff that y'all got going on.
Yes.
Yeah.
So I was telling you guys, my mom talked me into doing this. It's called EE Systems. It is a electromagnetic wave, and the particular wave is called a scalar wave, that is produced. It's just a box. We jokingly call it the cube. You go sit in front of the cube. So the treatment is really simple. You go and you either sit in a recliner or lay down for an hour. Some people will do it for 2 hours. The way I got started, my mom's like, you got to try it. And I'm like, Mom, I don't really want to do this, but I love my mom, so I did it.
Right, right.
And she says, we're getting ready to do it. And she has recliners in her area in Lafayette. And so I'm sitting there, and she says, most everybody falls asleep when they do this. I'm like, I'm not going to fall asleep. Within about 6 minutes, I was totally out.
Really?
Woke up an hour later, and, I was dreaming during the whole process, which is unusual for just, a short time period like that of sleep. And she started telling me all the people that they've healed that have had significant health problems that traditional medicine was not helping. And they're sort of on their last, hoorah or whatever to get this taken care of. And so I started doing it, made a believer out of my dad. And then she said, well, I'm getting a bigger unit. You've got to buy my smaller unit.
Oh, she was selling.
Yeah. So I brought it over here, and that's basically what it does. It's the scalar waves is supposed to stimulate your stem cells and activate them to go throughout the body and heal things. And the other thing that it does is I think it recalibrates your sleep mechanism some kind of way, because almost everybody does fall asleep in there. And they tell me when they go home, and this is what I experienced, I sleep better for another week or 10 days, meaning deeper, continuous dream sleep.
Right.
And I believe it's that REM sleep. The more that you get, the more your body will heal itself.
We are of the age now, at least I know I am, to appreciate the importance of sleep.
Absolutely.
When you're younger, it just doesn't matter. What, a couple hours here, it doesn't, full night, whatever. But when you get older, it's like, if I don't get sleep, I'm like a zombie the next day.
Because, sometimes I'm sure you guys do the same thing. I just wake up, it's 3:30. It's like,
what am I gonna do now?
I'm awake now.
Everybody else is sleeping.
So one really interesting aside, my mom's clinic in Louisiana has a big native Indian following.
Okay.
They come in, and it's their sleep and their dreaming is part of their religious experience.
Correct.
So they're coming for that to communicate with their ancestors.
Oh, that's really cool.
It's interesting, just culturally, how they look at it and what they do. think about.
Explain. So we sit down in a chair and you shoot these rays at us, pretty much, right?
It sounds like I'm taking a pot shot, but not really. You if you've been around any kind of electrical field, you can sort of feel it in your hair or on your skin, but it's not really that strong. It emits in this pattern, and all you do is sit there or lay there, and I have you bring some goggles or earplugs, and we turn the fan on, a little background noise, and before you know it, you're out.
Going back to like your location though, and I'm kind of thinking about somebody listening to this, like, I'm going to check it out. You offer so many different services. Do they need to call and book a specific service, or do I just kind of book an appointment and then kind of a consultation where we, go through the different things that you can do and I figure out what I want?
It's the latter. Just call, and you don't have to say, I need filler or I need PRP, because that's what we do when you come in, is try to figure out what you need. Because a lot of times people will come in and say, hey, I want to lose this small fat area right here. Do I need to have liposuction? I'll say, no, we have another machine for that, sculpture. And it would be perfect. It's not invasive. It's just a couple of treatments. Or they'll say the opposite. I saw sculpture or cool sculpting and I want to do that. And I look and I'm like, what bothers you? And it's really a region. It's a big area. I'm like, you're not going to get the results you want with that, but here's something else we do to really treat this whole area of your abdomen and to sculpture your figure the way you want it.
Yeah. Okay. So let them come in and
like I said, it's complimentary.
Yeah. The consultation. Yeah. So go in and let him figure it out for you.
Yeah.
I mean, really.
Body mechanic.
Because I'm sure people, that could be a barrier. Like, I don't even really know what to ask for. I don't know. It's like, just come in and tell me what's wrong, and then we'll go from there.
Or, it could be very personal, something very personal. So you don't have to tell the lady up front.
Right. Like the ED thing. I mean, for a man to talk about that, especially with a woman, right? It's like, nah, just tell Doc I'm coming in. We'll figure it out.
Yeah. I have something I need to talk to him about.
It would be fine. So. Well, man, that's cool. We're always interested in hearing about stuff like this, for men. I know whenever we got the message there, like I say, when we saw, OBGYN gynecology, I'm like, oh, I'm interested. Let's see what he wants to come talk about. So we appreciate you, reaching out to us.
No, it's my pleasure. A lot of this stuff, we're just trying to get the information out to the public.
For sure.
And not all of us are on Instagram or TikTok or, or to get correct information. That's a lot of times, people will come in and say, oh, I heard this, that. And it's like, no. Let's sit down. Let me tell you about it. I've done this. I've done that. I can tell you. This, something like that. Get the correct information out.
Absolutely.
Are y'all traditional hours, Monday through Friday, or how does that work?
Yeah. We're there Monday through Friday from 9 to 5. We do extended hours on Tuesdays till about 5:30 or 6. And then I've come in and done liposuctions on people on Saturdays. I've done other things for people that they're like, hey, I'm going to be in town for these 2 days, and can you fit me in? And we look out and try to fit them in somewhere. Take care of them.
Give that call. That's what we got to do. Get that call.
That's right.
Give us a call. We'll fit you in somewhere.
That'll work. Well, man, we appreciate your time coming in here and talking to us about it, and for taking care of people on the Gulf Coast. Who said you couldn't do on an outdoors focused podcast? You couldn't do aesthetics and gynecology.
That's right.
We nailed it. I think we pulled it off.
Yeah.
Thanks for having me. I really appreciate
absolutely.
it.
And when you go see them, remember, tell them that you saw it on the Brown Water.
Let them know. He was like, hey, I didn't know what the hell they were talking about. I thought they were trying to tank their show, but it made a lot of sense, and I'm glad I heard it. So thank y'all for watching on the live, the replay, and in the podcast world. We appreciate it. If y'all keep watching.
Keep doing it.
That's right.